Dr. Mina, you may start now.
Good evening, everyone. My name is Mina Ashraf. I'm Marketing Director at Lunatus, and today we will present to you Xylit as an anti-infective and a corticosteroid combo. Xylit is composed of Topromycin 0.3% antibiotic and loteprednol etabonate 0.5% as a corticosteroid to provide a treatment option for a wide range of ocular inflammatory conditions with the risk of infection. Xylit is designed to treat the ocular conditions where a corticosteroid therapy may be indicated and when the risk of a superficial bacterial infection may coexist. Xylit is composed of two components. First is the innovative ocular corticosteroid loteprednol etabonate, which is the only corticosteroid designed to specifically treat ophthalmic inflammation, very well known for its quick transformation into inactive metabolites upon instillation to provide a lower toxicity profile and reduce the propensity for elevation in intraocular pressure. In addition to tobramycin, a broad-spectrum antibiotic used to suppress bacterial infections or prevention when the risk of infection is high, known for its broad spectrum, good penetration into the cornea, and well-tolerated and good safety profile. Starting with loteprednol etabonate, corticosteroids have a broad anti-inflammatory effect, and they are known to be the most effective anti-inflammatory medications because they are the anti-inflammatory medications that can block the inflammatory cascade at its earliest stages. So that's why corticosteroids have always been a cornerstone in the treatment of ocular inflammatory conditions. However, corticosteroids are limited with their side effects, including elevation of the intraocular pressure and formation of posterior subcapsular cataracts. For the elevation of the intraocular pressure, this is caused because with corticosteroids, when they accumulate in the ocular system, they inhibit the degradation of the extracellular matrix materials in the trabecular meshwork, which leads to an accumulation of those materials in the outflow channels, and this leads to an increase in the outflow resistance. The second challenge with the conventional corticosteroids is the formation of posterior subcapsular cataracts, because at the C20 position, there is a ketone group in all the conventional steroids, which interacts with the lens proteins, leading to the formation of a Schiff base, and this leads to the development of posterior subcapsular cataracts. And here comes Xylit loteprednol as the only eye-tailored corticosteroids. All corticosteroids have been initially developed to treat systemic inflammations, and then they were adapted into ocular drops. But Xylit's loteprednol is the only ester steroid, the only eye-tailored corticosteroid developed for the treatment of ocular inflammation. In terms of chemical structure, it is the same as prednisolone, which is the parent compound, with one change, which is changing the C20 ketone group by a C20 ester group. This has been tailored to the eye by using the retrometabolic drug design. And in retrometabolic drug design, we start with the inactive metabolite of the original compound. So they studied the metabolism of prednisolone in the ocular system, and it gets metabolized into active and inactive metabolites. We start working on the inactive metabolites in a retrometabolic pathway in order to reach a new compound that shares the same characteristics of the original product. But this new compound will have a predictable metabolism only into inactive metabolites. So with loteprednol etabonate, it provides the same anti-inflammatory effect of prednisolone, but with a predictable metabolism only into inactive metabolites, with a single-step inactivation to avoid the drug accumulation in the eye with the subsequent elevation of IOP and the unnecessary interactions with the lens proteins. And this leads to an improved therapeutic index. The improvement in the therapeutic index is the ratio between the toxic dose and the effective dose, and the therapeutic index of Xylit is 20 times more than dexamethasone. So with Xylit, we can provide what we call the soft steroid concept. A soft steroid is a corticosteroid that provides the same degree of anti-inflammatory effect, but with a more favorable safety profile, manifested as a reduction in the risk of intraocular pressure and the reduction in the cataract formation. Also, in Xylit, loteprednol is almost 10 times more lipophilic than dexamethasone, which leads to 4.3 times more glucocorticoid receptor binding affinity compared to dexamethasone and prednisolone. So in summary, Xylit has loteprednol, which have been shown to have the right balance of lipophilicity to aqueous solubility required for an effective ocular tissue penetration. Also, loteprednol etabonate readily penetrates the ocular tissues with 10 times more lipophilicity, 4.3 times higher binding affinity than dexamethasone, and 20 times better therapeutic index. In the Xylit formulation, loteprednol reaches excellent concentrations at all the target tissues in the anterior segment, starting with the cornea, iris, ciliary body, and down to the aqueous humor. Loteprednol has proven efficacy in a wide range of ocular inflammatory conditions. For example, in post-cataract inflammation, Xylit achieves 91% reduction in the anterior chamber cells and 93% reduction in the anterior chamber flare after 14 days. And in comparison between loteprednol and prednisolone, loteprednol was found to be as effective as prednisolone in the treatment of post-operative cataract surgery inflammation, but with a more favorable effect on the intraocular pressure, and the difference in IOP reached its statistical significance at day 3 of treatment. In another study, a group of steroid responders which were exposed to prednisolone acetate for 2 weeks, and they had a significant increase in the IOP reached 31 millimeters mercury, shifting them from prednisolone to loteprednol etabonate resulted in a 41% reduction in the intraocular pressure without any cases of acute graft rejection or worsening of the inflammation. Finally, in a comparison between loteprednol, prednisolone, and fluorometholone in patients with vernal keratoconjunctivitis, both loteprednol and prednisolone were equally effective, and they were more effective than fluorometholone. But loteprednol showed the most favorable effect on IOP, while the highest elevation in IOP was observed with prednisolone acetate, to the degree that 15% of the patients on prednisolone had to quit the study because of an IOP elevation that required a medical treatment. The second component of Xylit is topromycin, which is a broad-spectrum antibiotic used to suppress bacterial infections or to prevent the bacterial infections when there is a risk of infection. Topromycin is known to have a broad spectrum of action against a wide range of ocular pathogens. Most of the common ocular pathogens are covered by topromycin. And in the Xylit formulation, the lotepred etabonate concentration in the aqueous humor with or without topromycin was the same, which means that in Xylit, loteprednol and topromycin do not affect the pharmacokinetics of each other, so they are very suitable for combination. Also, in the Xylit formulation, it is formulated to have a steady concentration of topromycin in the tear film up to 240 minutes. We can see here that the topromycin tear film concentration is higher than the minimum inhibitory concentration required to kill 90% of most of the common ocular pathogens. Third component of Xylit is we've covered loteprednol etabonate, then topromycin, and finally, Xylit also contains moisturizing glycerin and povidone to provide ocular lubrication and ocular moisturizing, and this helps improve the patient comfort and their overall experience with Xylit. To conclude, Xylit has been compared to dexamethasone topromycin combination, like as a fixed dose combination. There are studies comparing loteprednol topromycin combination in Xylit and dexamethasone topromycin combination. Both treatments were equally effective in the reduction of symptoms of patients of inflammation associated with peripheral keratoconjunctivitis. Both Xylit and dexamethasone topromycin could achieve 78% reduction from baseline symptoms after 14 days of treatment in patients with blepharokeratoconjunctivitis, but Xylit maintained a favorable effect on the intraocular pressure compared to a significant elevation in the intraocular pressure in patients with dexamethasone topromycin. So this was like a significant improvement in the treatment experience to maintain the same effect, but with a steady effect or a favorable effect on the intraocular pressure. In a group of healthy volunteers, more than 4 times the dexamethasone topromycin achieved IOP elevation in a number of patients more than 4 times higher than that in Xylit. Percentage of healthy volunteers who had IOP elevation was 1.9% in Xylit compared to 8.7% in dexamethasone topromycin. In summary, Xylit is a combination of loteprednol etabonate, the retrometabolically designed analog of prednisolone, metabolized by endogenous esterases to its inactive metabolites. So there is no accumulation of loteprednol in the ocular system. It has the same concentration as in Lotimax. And in Xylit, we can see that the preparation is 10 times more lipophilic than dexamethasone, with 4.3 times greater receptor binding affinity, and with a less likely to cause IOP elevation compared to ketone corticosteroids such as prednisolone or dexamethasone. In combination to topromycin 0.3%, a product with 20 years of clinical experience, broad spectrum aminoglycoside with bactericidal effect, active against most of the common ocular pathogens, and with a steady tear film concentration in the Xylit formulation to cover 6 hours with tear film concentration more than that required to kill 90% of the bacteria. Xylit is approved by the US FDA for the treatment of steroid-responsive inflammatory conditions for which a corticosteroid is indicated and where superficial bacterial ocular infection or a risk of bacterial infection coexists. And it is designed to be used with this dosage. Apply 1 to 2 drops of Xylit into the conjunctival sac of the affected eye every 4 to 6 hours. And thanks to the improved therapeutic index, the FDA has approved Xylit to be used in the first 1 to 2 days. The dosing may be increased to every 1 to 2 hours, and then the frequency should be decreased gradually as warranted by the improvement in clinical signs and symptoms. So the dose is 1 to 2 drops every 4 to 6 hours, but in the first 1 to 2 days, the dose can be increased up to 1 to 2 drops every 1 to 2 hours to counteract if we have a severe infection or inflammation. And recently, loteprednol has been approved for use of children from newborn, and this has been an update on the FDA approval of loteprednol just few weeks ago. Thank you very much, and it was a pleasure being with you. Thank you.